I am the Dr. William Tharnell, a doctor specializing in elderly health, with over 25 years of experience in geriatrics and integrative medicine. Today, I want to speak directly to you, a man in his 60s, and to the families who care for these men, about a silent danger that is affecting millions around the world. Did you know that more than 50% of men over 60 have some degree of prostate enlargement, and that, in some cases, this increase can lead to severe difficulties urinating, recurrent infections, and even the risk of surgery? These numbers don't come from a single country. They represent a global reality, confirmed by studies by the World Health Organization. But what almost no one talks about is that there is a common and seemingly harmless habit that can accelerate prostate growth, a habit that, unfortunately, many men practice every day, without realizing that they are feeding a problem that will rob them of quality of life and independence in the future. Throughout this video, we'll talk in a simple and straightforward way. I'll share real stories, scientific data translated into practical terms, and, most importantly, clear tips for protecting yourself, starting today. And I promise, in the end, you will find out exactly what is this dangerous habit and how to eliminate it from your routine. If this topic is important to you or someone you love, please like, share, and subscribe to the channel. This helps spread information that can literally save lives. The prostate is a small gland, about the size of a walnut, located just below the bladder and in front of the rectum. Despite its small size, it plays an essential role in men's health, particularly in the production of seminal fluid, which protects and nourishes sperm. However, as the years go by, it is natural for this gland to increase in size, a process called benign prostatic hyperplasia. Although it is not cancer, this increase can cause a series of problems, from the frequent urge to urinate to difficulty emptying the bladder completely. The most important thing is to understand that prostate health doesn't just affect urination. It directly impacts a man's quality of life, sleep, vitality, and even emotional state. Poor sleep due to waking up multiple times to go to the bathroom, for example, can compromise cardiovascular health, memory, and energy for daily activities. Therefore, taking care of the prostate isn't just about preventing disease, it's about preserving autonomy, well-being, and dignity. This is precisely what we'll explore in depth throughout this video. When we talk about an enlarged prostate, we are not dealing with something rare or isolated. According to the World Health Organization, WHO, it is estimated that more than 210 million men on the planet live with some degree of benign prostatic hyperplasia. In the United States, data from National Institute of Diabetes and Digestive and Kidney Diseases show that 50% of men between 51 and 60 years old already have an enlarged prostate, and that this number rises to 80% or more among those over 70 years old. In Canada, studies conducted by Canadian Urological Association point out that about 1 in every 4 urological consultations in men over 60 years of age is related to prostate problems. In the United Kingdom, the National Health Service, NHS, estimates that about 3 in 4 men over 70 years of age present symptoms of an enlarged prostate. In Australia, the problem is also widely documented. Surveys of Prostate Cancer Foundation of Australia indicate that prostatic hyperplasia is one of the main causes of urological hospitalization in elderly men. The most worrying thing is that in all these countries, less than half of men who experience symptoms seek medical help immediately. Many people believe that urinating more frequently or waking up several times at night is part of getting older, when in fact they are signs that need attention. These data reinforce that prostate enlargement is a public health challenge in English-speaking nations, requiring greater awareness and prevention. Robert, 68, is a retired veteran living in Ohio, United States. He's always been active, enjoying fishing on weekends and spending time with his grandchildren. But about 2 years ago, he began noticing something strange. He would wake up several times a night to urinate. At first, he thought it was simply a consequence of drinking more water during the summer. Over time, the situation worsened. Robert began avoiding long car trips because he had to stop frequently to use the bathroom. Even meeting up with friends became uncomfortable, as he spent much of the time searching for a restroom. Out of shame and stubbornness, he delayed seeking medical help for over a year. When he finally went to the urologist, the diagnosis was clear: advanced benign prostatic hyperplasia. The doctor explained that if he had sought help earlier, the treatment could have been simpler and less invasive. Today, Robert is undergoing treatment and has managed to improve his symptoms, but he admits that his biggest regret is not taking action sooner. He shares his story to warn other men. Ignoring the signs doesn't make the problem go away, it just makes it worse. Over the years, I've seen hundreds of men who came to my office with symptoms of an enlarged prostate. Many of them shared something in common. They engaged in a seemingly harmless habit almost daily, but it was silently fueling the problem. This habit isn't directly related to age or genetics. It can be part of any man's routine, whether he's a retired worker, a businessman, or someone who leads a quiet life in the countryside. What makes it so dangerous is precisely the fact that it is discreet and often even encouraged by certain modern routines. When I explain this to my patients, their reaction is usually the same. First silence, then a look of surprise, followed by, "But doctor, I've been doing this for years." And that's where the warning comes in. The human body has an incredible ability to adapt, but also to accumulate damage over time. Small, repeated daily aggressions can have a major impact after years of repetition. This habit puts constant stress on the prostate and bladder, causing inflammation and hindering proper function. Over the months, or years, this process leads to an increase in prostate size, narrowing of the urethra, and all the symptoms we know: weak stream, urgency, and frequent nighttime awakenings. In this video, we'll keep this mystery until the end, not out of whim, but so you understand the full context. It's essential to understand how the prostate works, the risk factors, and prevention methods before identifying the culprit. That way, when I reveal it, you'll have the clarity you need to decide whether you're willing to change this habit starting today. And I can guarantee, many men, upon discovering this, realize it's a simple change, but one that requires discipline. The reward? More comfort, more independence, and more peace of mind to live well after 60. The prostate is an extremely sensitive gland to the body's balance. Small changes in urinary flow, pressure on the bladder, or local blood circulation can trigger inflammatory processes. The habit we are talking about acts precisely on these 3 points. It increases internal pressure, makes it difficult to completely empty the bladder and reduces tissue oxygenation. When the prostate is subjected to this type of stress frequently, the body reacts as it would with any chronic irritation. The cells increase in size to protect the area, which we call hypertrophy. In the case of the prostate, this increase in volume compresses the urethra, making it difficult for urine to pass through and forcing the bladder to work harder. The result is a vicious cycle. The habit causes irritation. Irritation leads to enlargement of the prostate. An enlarged prostate worsens urinary flow. Reduced flow increases irritation and the risk of infection. Over time, this persistent inflammation can also affect other areas, such as sexual function, as the nerves and blood vessels around the prostate are directly linked to erection and pleasure. Research carried out by Harvard Medical School show that men who engage in this type of behavior have a significantly higher risk of developing moderate or severe symptoms of prostatic hyperplasia. And most worryingly, many only realize the true impact when their quality of life is already significantly compromised. Therefore, understanding this mechanism is essential so that changing habits doesn't seem like just medical advice, but rather a logical and urgent decision to preserve health. Many men believe that the first signs of an enlarged prostate are obvious. But in reality, they are often subtle and easily attributed to getting older. This is precisely the trap. Most people don't realize they have a problem until the symptoms become limiting. The most common signs include increased urinary frequency, especially at night. If you get up 2 or more times to urinate, something might be wrong. This isn't just a nuisance. Repeatedly interrupting your sleep affects your cardiovascular health, memory, and mood. Weak or intermittent urinary stream. Many men describe their urine as losing strength along the way. In some cases, the flow starts and stops several times, which is a clear indication of obstruction. Sensation of incomplete bladder emptying. Leaving the bathroom and feeling that there is still urine is a classic symptom of obstruction due to an enlarged prostate. Urgency to urinate. The urge comes on suddenly, and in some cases, there's no time to get to the bathroom. This can cause embarrassment and even lead to episodes of incontinence. Dripping after urination, a discreet sign, but one that may indicate that the bladder is not emptying properly. The problem is that many people view these symptoms as a natural part of aging and don't seek medical attention. However, the earlier the diagnosis is made, the simpler the treatment and the greater the chances of avoiding complications. As a doctor, I can say this clearly: if you experience one or more of these symptoms, don't wait. Investigate. Your health and quality of life depend on it. When we talk about prostate enlargement, many men believe that the main cause is simply genetics or advancing age. But in practice, what I see in the office is that there are a series of everyday behaviors that act as silent accelerators of the problem. Among the most common mistakes, I highlight ignoring the first symptoms. This is undoubtedly the most serious mistake. Delaying a visit to the doctor, hoping it will go away on its own, only allows the prostate to enlarge and symptoms to worsen. Low water intake. Many men think that drinking less water will reduce bathroom visits. In reality, this concentrates urine, irritates the bladder, and promotes inflammation, creating a more hostile environment for the prostate. Holding urine for a long time. This is a destructive habit. Keeping your bladder full for prolonged periods increases pressure on the prostate and urethra, as well as promoting infections. Excessive caffeine and alcohol, coffee, black tea, soft drinks, and alcoholic beverages irritate the bladder and stimulate more frequent urination, worsening existing symptoms. Sedentary lifestyle, lack of physical activity reduces blood circulation in the pelvic region, which can contribute to inflammatory processes. Self-medication. Taking medications to facilitate urination without a prescription can mask important symptoms and delay a correct diagnosis. These behaviors, combined or maintained for years, create fertile ground for the prostate to enlarge more rapidly. Correcting these mistakes is an essential step in protecting your health and reducing the impact of the dangerous habit I'll reveal at the end of this video. Knowing if you are at risk of developing prostate problems is crucial to acting early and avoiding complications. Based on my clinical experience and international studies, I have developed a checklist simple so you can evaluate your own case. If you answer yes to 2 or more of these questions, we highly recommend seeing a doctor for a thorough evaluation. Do you get up 2 or more times at night to urinate? Is your urinary stream weaker than it used to be? Do you feel like your bladder doesn't empty completely after urinating? Have you ever had episodes of intense urgency to urinate, almost unable to hold it? Do you notice dripping after you finish urinating? Do you have a family history of prostate problems? Do you spend a lot of time sitting during the day without taking breaks to move around? Do you frequently drink coffee, soft drinks, black tea, or alcoholic beverages? Do you avoid drinking water to reduce trips to the bathroom? Are you over 60 years old? This checklist doesn't replace a medical consultation, but it serves as a warning. The earlier you identify risk signs, the simpler and more effective treatment will be, and the greater the chances of avoiding surgery or serious complications. Protecting your prostate doesn't require radical or complicated changes. In fact, small adjustments to your routine can have a huge impact in long-term health. Here are simple and effective changes I recommend to my patients. Hydrate yourself properly. Drink between 1.5 and 2 liters of water throughout the day. Spread out your intake to avoid overloading your bladder all at once. Avoid holding your urine. Whenever you feel the urge, go to the bathroom. Holding it for too long increases pressure on the prostate and bladder. Reduce caffeine and alcohol. Limit your consumption of coffee, black tea, soft drinks, and alcoholic beverages, as they irritate the urinary tract. Take breaks to move around. If you spend a lot of time sitting, get up every hour and walk around for a few minutes. Practice regular physical activity. Walking, swimming, or light exercise help improve circulation in the pelvic region. Include anti-inflammatory foods in your diet: tomatoes, pumpkin seeds, walnuts, fish rich in omega-3 and dark green vegetables are allies of prostate health. Maintain a healthy weight. Excess abdominal fat increases the risk of inflammation and hormonal changes. Get preventive exams. Visit the urologist at least once a year, even without symptoms. The sum of these measures forms a powerful barrier against the progression of prostatic hyperplasia and improves quality of life. Nutrition and hydration are two fundamental pillars of prostate protection. Many of my patients are surprised when I explain that what we put on our plates and in our glasses every day can directly influence the size and health of this gland. 1. Invest in anti-inflammatory foods. Include cooked tomatoes, rich in lycopene, an antioxidant that helps protect prostate cells. Other allies include broccoli, kale, spinach, pumpkin seeds, and walnuts. 2. Consume healthy fats. Fish such as salmon, sardines, and mackerel, rich in omega-3, reduce inflammation and improve circulation in the pelvic region. 3. Reduce ultra-processed foods. Processed foods, rich in salt, sugar, and trans fats, increase the risk of chronic inflammation, which can worsen prostate enlargement. 4. Hydrate yourself throughout the day. Ideally, you should drink between 1.5 and 2 liters of pure water per day. This helps flush the urinary tract, preventing infections and reducing the concentration of irritants. 5. Avoid overeating at night. To avoid compromising your sleep, reduce your liquid intake in the 2 hours before bed. 6. Be careful with caffeine and alcohol. Beverages like coffee, black tea, soda, and beer irritate the bladder and increase urinary frequency. Moderation is key. By following these guidelines, you not only protect your prostate, but also strengthen your entire body, improving your energy, mood, and physical endurance. Physical activity is one of the most powerful tools for maintaining prostate and overall body health, especially after age 60. It's not about seeking high performance or strenuous training, but rather about keeping the body active in a healthy way. Safe, regular, and adapted to your physical condition. 1. Improved pelvic circulation. Exercises such as walking, swimming, or stationary cycling stimulate blood flow to the prostate region, helping to reduce inflammation and prevent the progression of benign prostatic hyperplasia. 2. Weight control. Abdominal fat accumulation is associated with a higher risk of chronic inflammation, which can directly impact the prostate. Regular physical activity helps maintain a healthy weight. 3. Strengthening the pelvic floor. Specific exercises, known as Kegel exercises, strengthen the muscles that control urination and help empty the bladder completely. 4. Stress reduction. Physical activity releases endorphins, which improve mood and help reduce stress levels, a factor that can worsen urinary symptoms. 5. Recommended frequency. Practicing at least 150 minutes of moderate activity per week is ideal, spread out throughout the days to maintain regularity. Remember, before starting any new exercise program, especially after age 60, talk to your doctor to ensure the activities you choose are safe for you. Regular medical checkups are one of the most effective strategies for maintaining prostate health and preventing complications. Many men seek help only when symptoms become unbearable, but prevention works in the opposite way. The earlier a problem is detected, the simpler and less invasive the treatment will be. 1. Annual consultation with a urologist. From the age of 50 or 45, if there is a family history of prostate cancer or prostatic hyperplasia, it is essential to visit a urologist at least once a year. 2. Digital rectal examination. Although it may be difficult for some men to perform, it is a quick and painless test that allows the doctor to accurately assess the size and consistency of the prostate. 3. PSA, prostate-specific antigen, test. This is a simple blood test that helps identify changes in the prostate before symptoms even appear. 4. Transrectal or pelvic ultrasound. Used to complement the diagnosis, especially when there are doubts about the size of the prostate or the presence of nodules. 5. Symptom monitoring. Keeping a record of urinary frequency, stream intensity, and any discomfort helps your doctor monitor your progress. Regular medical checkups not only protect against serious problems, but also provide peace of mind to live with greater security and confidence. We have reached the most important moment of this conversation. The habit that silently contributes to prostate enlargement and that millions of men maintain daily isholding urine for long periods. It may seem like a simple, even unimportant gesture, But the reality is that every time you ignore your body's signal to go to the bathroom, you're putting extra pressure on your bladder and prostate. This pressure, repeated over the years, causes inflammation, compromises urinary flow, and creates an environment conducive to prostate enlargement. Many of my patients have told me, "Doctor, I didn't know this was harmful. I always thought it was normal to wait a little longer." This is precisely the trap. Small habits, when repeated, have big consequences. And in the case of the prostate, these consequences can mean sleepless nights, pain, surgeries, and a loss of quality of life. The good news is that you can change this situation starting today. Go to the bathroom whenever you feel the urge, even if it interrupts what you're doing. Health should come before convenience. This simple change will relieve pressure on your prostate, improve your daily comfort, and prevent complications. But don't stop there. The information you just received is too valuable to keep to yourself. Share this video with your friends, brothers, fathers, and any man in his 50s, 60s, 70s, or older. Subscribe to the channel to access more practical guidance based on science and my experience of over 25 years caring for the health of the elderly. The more men understand that prevention is the best medicine, the fewer stories we will see of unnecessary suffering like the ones I have seen. I am the Dr. William Tharnell. It's been an honor to accompany you this far. See you in the next video. And until then, take care of yourself, because no one else can live your life for you.